Hello everybody, my name is Dr. Ayodele Rena. I'm a consultant pediatrician and you might know me on Instagram as the Easy Niger pediatrician and the first of his name, head of all the constituency members in the whole Lagos. I think the most important challenge that mothers experience is the lack of support, and by lack of support I mean to say that sometimes mothers don't have that system that makes breastfeeding easier for them, such that they are literally the only ones doing what they need to do, and depending on the circumstances, maybe their mother-in-laws are really not available to come for the famous omugwo, and of course their partners are usually at work or they are usually quite busy, and most of them don't even get anything like paternity leave. If they get 3 days maximum, and then they are back to work. And so this puts a lot of pressure on mothers who are breastfeeding, especially if they have older children like toddlers who don't want to hear that there is anybody in the house that they're breastfeeding. And so what happens is that they still have to do their chores, they're still needing to cook, and they're doing everything alongside breastfeeding. And of course, this lack of support can actually significantly impact how well they lactate and how well they breastfeed. So I think that probably is one of the most common challenges that I encounter when mothers talk to me about feeding and breastfeeding. Social media, as we know, is very impactful in determining what decisions mothers and mothers-to-be take as far as breastfeeding is concerned. So social media, of course, is a great source of information, but sometimes you do get some misinformation, and you'll see some people saying things like, oh, palm wine can make breast milk flow better. No form of alcohol makes breast milk flow better, not palm wine. No alcohol makes breast milk flow better. So sometimes there's misinformation, and mothers might actually take this to heart. I know that the campaign to make sure that mothers exclusively breastfeed has been ramped up, and there is widespread acceptance of the benefits and the importance of exclusive breastfeeding. But you might still find some people that think that offering formula to their child is just as good as breastfeeding, and you might find that actually even on social media. But I'd say on the whole, over the last few years, the message about exclusive breastfeeding has positively influenced women's decision to breastfeed. Let me just give an example. There was once I actually saw a mother who said that giving coconut milk to the baby before even giving breast milk is one way in which a mother can prevent their baby from having colic. And of course, we know that colic is very, very disturbing for both the mother and the baby. And so introducing anything other than breast milk before breast milk is commenced is what we call prelacteal feeds. And giving prelacteal feeds, whether it's coconut milk, whether it's agbo, whether it's small style toe, the problem is that it prevents the mother from establishing lactation on time. And so we don't want any prelacteal feeds, and that is something that even educated women are promoting on the social media space. And so we say, look for healthcare information from the right sources and from reliable sources, and you should, have everything okay. Mothers who have multiple pregnancies, that's what they're called, so multiple births, they present quite a challenge for mothers who want to exclusively breastfeed. So first thing I'd like to say is that the counseling for such mothers should happen right from the antenatal clinic, because it is in the antenatal clinic that they begin to prepare their minds for what is to come if they decide to exclusively breastfeed. Now, for such mothers, exclusive breastfeeding is definitely an option, but it is definitely more challenging than for a mother who gives birth to just one baby at a time. And this is because there are more mouths to feed, and the body's supply of breast milk is not infinite. But what can be done is that if they mean to breastfeed, they can express regularly and store this breast milk in the freezer, and breast milk that is properly frozen in band A freezer, not band D freezer that you are living in, band A freezer, then it can actually stay for up to a year and can still be given to the babies. But some mothers find it difficult, and so the alternative, if it cannot be breast milk, is getting breast milk from a breast milk bank. Now, breast milk banks, they are available in Nigeria, but of course, it's something that a lot of parents don't know about, and a lot of mothers might be reluctant to explore. But please ask your healthcare provider if they have any idea of where breast milk banks exist, and hopefully they'll be able to supply you with some breast milk. If that is not available, or you do not think that breast milk bank or banked breast milk is something that you'd like to do, then formula is definitely an option. But please always have a discussion with your doctor, your physician, your healthcare professional, your nutritionist or dietitian about the formula to introduce that is right for your baby. And of course, this is something that is definitely an option. But please, no glucose water, no other strange alternatives like pap at 2 months or those other weird, outrageous things that people end up doing when they mean to make sure that these babies get fed. Advocacy for breastfeeding really is something that we all need to be promoting, and not just in one language. We need to talk about breastfeeding in all the languages possible. How many languages are there in Nigeria? You should know. Over 250? I think we need to get the message out there to tell people that, look, breastfeeding is best. That's the number one message that we need to talk about. Exclusive breastfeeding for 6 months without adding water or pap or agbo or any other sort of liquid that isn't prescribed by the physician is also very important. And advocacy also involves communities. So asking communities and telling communities that breast milk is best is probably one of the most important investments that a woman or a community can make in the child, such that it prevents infections later in life. We cannot leave out policymakers. Policymakers are very important. So how many months are you giving mothers for leave, for maternity leave? How many years are you giving fathers for paternity leave? Because fathers also need paternity leave as well, just to support and assist the mothers. Workplaces, do you have creches? Do you have breast milk rooms where mothers can go and express, where they can go and breastfeed quietly if there is a creche in the workplace? These are all the measures that we need to be advocating for to make sure that breastfeeding mothers are supported and that breastfeeding is the go-to nutritional option for all new mothers and mothers-to-be. When it comes to the challenges of breastfeeding, the reality is that there are some mothers who, despite all their best efforts, will not lactate, and the breast milk simply won't flow, and the baby is there starving. Baby is frustrated, mother is frustrated, baby is in tears, mother is in tears, father is in tears. They bring the baby to the hospital, doctor joins them in the crying. And so the challenge is real, and such that some mothers actually are not able to breastfeed. In such situations, we always say, you know what, contact your healthcare professional. Don't feel guilty, don't feel less of a mother. You are as much a mother as any other woman who is lactating. And so what we always say is that speak to a lactation consultant, try to identify what the challenges are, and don't be shy to discuss the option of breast milk, banked breast milk, or even formula with your healthcare professional if you find out that lactation truly is a challenge for you, so that the baby doesn't starve and so that you don't end up being frustrated at the challenge that you have in establishing lactation. That being said, please make sure that you're looking for all the support that you can get wherever you can get it from. Speak to other mothers, because motherhood is such a shared journey, and mothers who have gone through it are such a wealth of resources as far as giving information is concerned. They can help you through and support you in whatever it is that you are doing. Society, I think, needs to be more charitable to mothers who are not able to lactate as voluminously as some other mothers, and give them all the support that is required, and don't make them feel as though they are less mothers or they are not doing as well as mothers who are breastfeeding the babies. I mean, that's it. Women, as somebody said, for women who are concerned about maybe, my breast might sag if I breastfeed exclusively for 6 months, the breast is still going to sag whether you breastfeed or not. One day, it will fall. It will be dragging the ground. So, I mean, it's just inevitable. It's just simply part of the process. And I find that some women complain about the uneven sizes of their breasts, while they're breastfeeding, such that one breast might become larger than another. And so they're not sure whether to get one breast size, one size, the other side, another different size. So these are the challenges that happen with breast milk and breastfeeding. But you see, nothing can substitute the joy of motherhood. So, I mean, something's got to give. Either you choose motherhood or you choose lopsided breasts, I guess.